Hi, my name is Craig Horenchik, and my pronouns are he, him, and I am the Executive Director for the Alberta Municipal Health and Safety Association. AMS has really tried to meet both our employees and our members where they are in terms of mental health. Internally, we do a fair bit for education. We offer Not Myself Today, mental health first aid, the working mind, employee and family assistance programs, as well as quite a few free mental fitness webinars to our employees. But also just from wellness, people have a lot of personal commitments, and always having that good balance is important. So we do offer flexible work hours, compressed work weeks, extended wellness benefits, and we're also doing things like cognitive job demands analysis to really make sure we know what the mental health requirements are of the positions of our employees. One of the things we like to do, again, is make sure that we're meeting our employees and our members where they are. So when we take a look at what we've done for our membership, we try to make sure that they're participating in things like psychological health and safety audits for us. And at the end of the day, things like mental health days are a part of sick days as we take a look at just where people are as a whole person, being able to show up where they are in terms of their mental health on a good day or a bad day. And we like to be able to extend that to our membership as well. Externally for members, we've created a couple of very exciting programs that we're very happy to offer to membership. And one of the new ones that we've had is a optional psychological health and safety audit that's part of the Provincial Certificate of Recognition program, often referred to as CORE. So what we've tried to be able to do, again, is take a look at providing an audit that's optional, not mandatory, and scalable. So really reflective of the resources that were available to people. So you can do a level 1, a level 2, or a level 3 audit. And we were so excited to have that approved by the Government of Alberta Partnerships Program in September of 2022. Yeah, I think the other program that we're really proud of that's came to recently was an initiative to support rural first responders who were living with or at risk of post-traumatic stress injuries. And with support funding for the Government of Alberta, we did receive a supporting psychological health and safety in first responders Stream 1 services grant. And AMS is currently offering, as a result of that sponsorship and funding support, a free virtual delivery of the Mental Health Commission of Canada's The Working Mind First Responder to underserved and at-risk rural firefighters. We made it a priority for a couple of reasons. The first one, and the most important one, I think, is it really aligns with our values as an organization and our mission and vision statement. We exist to provide education and training and prevent mental illness as well as physical injury and harm. And it really aligned well. And that really speaks to the second point, is that psychological injury and illness is a leading cause of disabling injury, absence, and claim costs in the municipal sector. So it's not a matter of what happens if that were to become a problem. It's a problem today, as it is for many employers in North America. As a leader, be vulnerable sometimes to be able to speak about either a personal challenge you might have with mental health, one in your family or your expanded peer group. Often being a bit vulnerable is sometimes uncomfortable, especially talking about something that can be stigmatized like mental health, but don't be afraid to lead and be a bit vulnerable. Get the people who are affected by mental health, whether it's your employees, the interested parties of members, or the communities in which you operate, to understand what their challenges are. And you're more likely to have success if you get those groups involved rather than doing a top-down and pushing out something with all the best intent and effort. I mean, we're just so ecstatic to be able to receive part of this recognition. And while I'm here doing an interview, it's not my achievement, it's one for the organization. So many people on our teams put in effort to be able to put these programs together, strategic partners that we partnered with as subject matter experts in workplace mental health that helped us build these programs, and certainly our board of directors. Our board of directors is uniquely composed. We have half worker representatives and half employers. And so we really tried to be able to put programs together that met people where they were, either from the worker perspective or the employer, because sometimes those perspectives are a bit different. But trying to create psychologically safe workplaces is very important, and a challenge I would offer to everybody to be able to support in their communities in which they operate.